Carter's 10 C's model and outsourcing in healthcare. Understanding Carter's 10 C's model. It's a sunny morning at Say Hospital, and Eric is evaluating supplies for new batch of surgical equipment. To make the best choice, he uses Carter's 10 C's model, a checklist developed by Dr. Carter to assess potential suppliers. The model includes 10 criteria: competency, capacity, commitment, control, cash, cost, consistency, culture, clean, and communication to ensure suppliers meet Say Hospital's needs. It's like choosing a trusted partner for a community project, ensuring they are reliable and aligned with your goals. Eric needs a supplier for oxygen tanks. Using the 10 C's, he checks if the supplier is competent, has the capacity to deliver, and aligns with Say Hospital's commitment to quality care. This ensures patients in the ICU always have oxygen. You can explain Carter's 10 C's model as a framework for evaluating suppliers to meet organizational needs. Exploring Carter's 10 C's model. 1. Competency. Does the supplier have skilled staff with technical training or experience? Eric check if a supplier or surgical tool has trained technicians who can maintain the equipment, ensuring it works perfectly during operations. 2. Capacity. Does the supplier have enough resources, people, equipment, and processes for current and future needs? Eric ensures a supplier of bandages can deliver 1,000 packs monthly and scale up during a malaria outbreak, avoiding shortages. 3. Commitment. Is the supplier dedicated to quality with certifications like the ISO 9001 or quality control plans? Eric chooses a supplier with ISO 9001 certification for IV fluids, ensuring consistent quality for patient safety. 4. Control. Does the supplier manage its systems, like inventory and production, effectively? Eric verifies that a supplier of ventilators have contingency plans, ensuring delivery even during supply chain disruptions. 5. Cash. Is the supplier financially stable with healthy profit trends and liquidity? Eric reviews a supplier's financial records to ensure they won't go bankrupt in mid contract, securing a steady supply of syringes. 6. Cost. Does the supplier offer value for money, considering total cost of ownership, TCO, including maintenance and operation cost? Eric picks an X-ray machine with lower maintenance cost over a cheaper but less durable model, saving Say Hospital money long term. 7. Consistency. Can the supplier deliver on time and in full OTIF without defects? Eric selects a supplier with consistently delivers defect-free gloves, ensuring nurses have reliable supplies for patient care. 8. Culture. Does the supplier share Say Hospital's values and understand its operational constraints, like Ghana's health regulations? Eric works with a supplier who respects Say Hospital's patient-centered culture, ensuring timely communication and support. 9. Clean. Corporate social responsibility. Does the supplier have policies for sustainability, health, safety, and diversity? Eric chooses a supplier with a strong sustainability policy, recycling medical waste, aligning with Say Hospital's environmental goals. 10. Communication. Is the supplier integrated with modern communication technology and responsive? Eric picks a supplier who uses email or WhatsApp for real time updates on delivery schedules, keeping Say Hospital informed. You can identify and explain the 10 C's: competency, capacity, commitment, control, cash, cost, consistency, culture, clean, and communication, and their role in supply evaluation. Applying Carter's tenses in practice. Eric's desk is covered with supplier proposals, but Carter's tenses guide his decisions. For a major purchase like a new MRI machine, he applies each criterion carefully. He checks the supplier's technical expertise, competence, ensures they can deliver multiple units capacity, and confirms their financial stability, cash. He also evaluates their quality qualifications, that is their certifications, commitment, delivery reliability, consistency, and alignment with Say Hospital's values, culture. This thorough process ensures the supplier meets the hospital needs without surprises. During a cholera outbreak, Eric uses the 10 C's to select a supplier for IV fluid. He chooses one with strong communication system, a sustainable production process, and the capacity to deliver quickly, ensuring patients are treated promptly. You understand how to apply Carter's 10 C models to evaluate suppliers effectively in real world situation. What is outsourcing? As Sir Eric reviews Sir Hospital's operations, he considers outsourcing the strategic use of external providers to handle tasks traditionally done in house. Unlike procurement, which focuses on acquiring goods and services, outsourcing involves contracting out entire functions like cleaning or IT services. It's a strategic decision made by top management impacting the hospital structure and scope. Outsourcing isn't about offloading unimportant tasks, it's about focusing on core activities like patient care, while external experts handle non core functions. It can bring cash, reduce risk, or provide economies of scale, but requires careful planning. Say Hospital outsources its laundry services to a Kumasi based company. This frees up staff to focus on patient care while the providers use specialized equipment to clean linens efficiently, saving costs. You can explain outsourcing as the strategic contracting of non core activities to external providers, distinct from procurement. Strategic nature of outsourcing. Eric knows outsourcing decisions aren't taken lightly. They involve top management and complex considerations. Key questions include: which functions can be outsourced? How do we select providers? What kind of relationship will we build? Outsourcing impacts Eric's hospital's operations, requiring careful assessment of internal capabilities and external providers. Reasons for outsourcing include cash infusion, that is selling assets to providers like equipment for funds, risk reduction, spreading operational risk to external experts, resource gaps, filling gaps when internal skill are lacking, core focus, allowing the hospital to prioritize patient care, economies of scale, benefiting from providers' specialized efficiency. Say a hospital lacks in-house IT expertise, so Eric outsources its patient record system to a tech firm in Accra. The firm provides advanced software and support, allowing doctors to focus on treatment while improving record accuracy. You understand the strategic nature of outsourcing, involving top level decisions and considerations like cost, risk, and focus. Outsourcing in practice. Let's see how Eric handles outsourcing at Say Hospital. He's considering outsourcing the hospital's maintenance services. He assesses candidate functions. Maintenance is non core but critical. Provider selection. He uses Carter's tendencies to evaluate maintenance firms. Relationship management. He seeks a long term partnership for reliability. Efficiency. He ensures the provider uses modern tools to reduce costs. Eric outsources Say Hospital's cleaning to a local firm with a strong health and safety policy and reliable staff. This ensures wards stay hygienic, freeing nurses for patient care and reducing infection risk. As Sir locks his office at Sir Hospital, he reflects on a day of smart decisions, choosing a reliable supplier for surgical tools, using Carter's tenses and outsourcing cleaning to focus on patient care. You follow the story, learning how the 10C models ensure suppliers meet needs through competency, capacity, and more. We've also explored outsourcing as a strategic tool to enhance efficiency and focus. These concepts, rooted in Ghana's healthcare context, show how careful sourcing and outsourcing save lives. Thank you for listening to the Arid Podcast.